Welcome to the Health Workforce Technical Assistance Center's webinar series. This presentation is entitled Dissemination Strategies for Health Workforce Research, and it was presented by Patricia Moulton on April 22nd, 2015. Now, I'd like to go ahead and take a few moments to introduce today's presenter. Dr. Patricia Moulton is the Executive Director of the North Dakota Center for Nursing and President-elect of the National Forum of State Nursing Workforce Centers. She has been conducting health workforce research for 13 years and was the PI for a study examining dissemination strategies for the federally funded rural health research centers. She received her PhD in experimental psychology in 2002 at the University of North Dakota. Patricia?
All right, well, thank you so much for the invitation to present today. Today I'm going to talk about my health workforce and dissemination research journey because there are a couple of pretty unique paths that kind of coalesce together to bring me to present what I've learned today. I'm also going to talk about a dissemination study that we conducted and the key findings. I'll also talk about developing a dissemination plan, some key products and approaches, and then I'm going to pull everything together with a couple of examples. So to talk a little bit about my background, for 10 years, between 2002 and 2012, I conducted a longitudinal study of the needs, nursing needs of supply, demand, and education needs of North Dakota through a legislatively mandated study. So this study included over 30 different studies, and what is nice is I have several examples of both the bad and the good dissemination strategies that we used during that study. For more information, there's the website that you can get to. I also conducted in 2010 a study of 30 different healthcare professions, and I'm going to use one of those reports as an example as well. I was also involved in the development of a couple of national studies. One was looking at the Nursing Workforce Minimum Data Set, which was part of the National Forum of State Nursing Workforce Centers. So we developed a minimum data set, and there's a couple of publications there. And I was also a research team member for the National Council of State Boards of Nursing, National Forum of State Nursing Workforce Centers National RN Sample Survey in 2013. And I know one of the individuals that are attending the presentation today was a member of that research team as well. And you can get more information about that study at that website. But to turn over to talk a little bit about my dissemination research path, if you'll notice, I started doing workforce research in about 2002. In 2007, we were funded by the Office of Rural Health Policy, HRSA, to develop a Rural Health Research to Diverse Audiences project. And the original impetus for this project was to increase the visibility of the federally funded Rural Health Research Center. There's between 6 and 9 of those throughout the United States, and it was felt that a centralized effort was needed to increase the awareness of the national, state, and community level audience to the research from those centers. So I have the project team up there, and I will say that the toolkit that I'm basing a lot of the information off today, that there's actually a newly updated one by the crew at the Center for Rural Health, and that website link is there as well. But the information I'm going to share with you is primarily from the study between 2007 and 2010. So what did we do for the study? Since this is a research group, I'm going to talk just real briefly about the methodology. We conducted a qualitative study over a number of years. And what we did is we developed a list of stakeholders and had issue group meetings. So we had a national meeting one year, a state meeting the next year, and a community meeting the year after that. And what we did to get information from these groups is we brought together a lot of different examples of dissemination products at the time. So we contacted each of the Rural Health Research Centers and got examples of brochures and fact sheets and working papers and looked at websites. And we presented all that to these issue groups and asked them how did they use them, how could they be improved. And we compiled all that information into our 3 reports that you can get on that website at the Center for Rural Health. But I'm going to talk about some of the key findings today. So when we talk to the national audience, which by the way at the bottom of each of these slides I have a list of who was in each issue group. So for the national audience we really concentrated on a lot of the national organizations, especially ones that were involved with rural health research. And so what we found when talking to that particular audience is that they really suggested that we have a suite of products to fit the different needs for different people in your audience. So I know a lot of researchers produce large reports, usually large reports with a lot of tables and facts and p-values and significant values. But what they suggested was, while you need to have those reports, in fact, they're very important to have, a lot of your audience, your target audience, would probably be best served with shorter types of products that could refer to the larger ones. So they thought the full findings need to be available, but that fact sheets and other products should be distributed as well. In fact, one of the national audience participants indicated to me that one time they produced a fact sheet and did not produce the full findings report at the same time or before. And to be quite honest, she indicated that they got kind of caught. They had some significant national policymakers call and ask them questions, and they weren't prepared to answer them because they didn't have that full report available. They suggested using simple charts or graphs. Certainly the media is always looking for those sound bites. I put on this slide a map that the National Forum recently produced because we get a lot of questions about how the minimum data sets have been implemented. And so this is just kind of a simple way for us to display which states are doing what. And that's kind of a good example of what a national audience might need. They also indicated that there's constant turnover at national organizations and in congressional offices. So even though you might have gone and talked to them 2 years ago, there's a good chance those people aren't there anymore, and they didn't keep your information. So you constantly need to keep sending basic information and findings. And they also indicated that national organizations serve as knowledge nodes. They select relevant research findings and distribute them to their members. So making it in a way that is easy for them to share is also advantageous. I'm going to move on to the state audience. So again, the state issue group is below. It's a lot of mostly national organizations of state organizations. So for instance, the National Council of State Boards of Nursing, the Federation of State Medical Boards. What these individuals indicated to us is that, again, similar to the national level, that state organizations serve as information brokers to the audience. And they usually have to repackage information. So what they told us is a lot of the research that they get, they end up having to take it, pull a chunk out of it, and then link to the original report. And that what would be really useful is if researchers simply sent it to them in a format they could just simply put in their newsletter and then link to the website where the research is posted. They suggested that you should tailor the product for the particular state or organization. So for instance, if you have research findings that talk about physician workforce, certainly target the medical boards and the other hospital association, those organizations that might be most likely to pick it up. And they also indicated they did not find research documents very useful. They indicated they spend, very little time on each document because they're going through a lot of information, so they prefer fact sheets and policy briefs. And they especially like it if you have state-level data. They especially like it if they're state-by-state comparisons or at-glance charts. What I put on the slide here is actually a newsletter because I'm a director of a state-level organization. And I will say a lot of these organizations at the state level will have, at this point, electronic newsletters that they send out to their members. In our case, we have an 18,000 subscriber database that we send out each month to. And so these are pretty awesome ways to get your research out. So certainly, and we're always looking for articles as well, and I'm sure most of them are. So I would love it if a researcher would send me an article to put in our newsletter. When we talked to the community audience, we found, first off, it was difficult to identify the community audience. Certainly once you start looking there, you're looking at colleges and universities, healthcare facilities, and smaller economic development groups. This group tends to be the hardest one to reach. So what we found is, again, they serve as information resources to the members. Again, they like information that's just easy to copy and send to their members. But what they suggested was that other strategies, such as sending copies of fact sheets for them to distribute at meetings, have them available at exhibits, or even just marketing products that they could bring back and share with their organization so they could go look on the website or your Facebook or whatever site you're using to get more information. And I would say I put a web link of the Colorado Center for Nursing Excellence up here, because what's nice about it is they display kind of a rotating workforce research banner on there. And so then when they send, when individuals in the community are looking for information, they go to their website and they can see key data points that are important to their communities. So how do you develop a dissemination plan? This graphic and this format of a dissemination plan is actually derived from the Agency for Healthcare Research and Quality. I put the full website on the slide, so you can certainly go and access it. I just actually checked to make sure it was still live, and it is. And so the 6 steps of a dissemination plan include figure out what research findings you're interested in disseminating. All of us have, you know, maybe 100-page research reports, but you really need to narrow down to what findings you think are going to be the best fit with your end users, which is the second step, identifying your target audience. What you might find in many cases is that part of your research study is good for one audience and another part is good for another audience. So those are some of the 2 initial steps to developing your plan. Finding dissemination partners is also important. I know a lot of us tend to feel that we need to do a lot of our dissemination right out of our office. You know, we go when we're asked to present at conferences, or we submit abstracts, or if we happen to be exhibiting, we'll put it out. But using those information brokers that the national, state, and community audience talked about is a really powerful way to really spread your research information. Communication is another step in figuring out which communication channel will result in the greatest impact. In-person or person-to-person communication is powerful, but sometimes social media is, at this point, a more powerful medium than person-to-person communication. So figuring out, based on your end users and what your research findings are, what communication channel will be the best to use. And certainly evaluate. So it's important as you develop your dissemination plan that you evaluate to see how often your product has been used. So if you're using something like a website or a Facebook, you can easily count how many downloads a document has had, or hits, or likes. And that's a powerful way to find out if people are paying attention to your research or not. And if they're not, revisit your dissemination plan. And then certainly developing a work plan, which will organize your strategy across products. So I'm going to use these steps as I talk about each of the primary products that are used. And before I get to that, an important overlying topic is developing effective titles. And I will say I haven't exactly figured this out entirely for myself. I'm not good at developing titles, but I will say that we found in our study that interesting, accurate titles will determine whether a document is read or ignored. So you should keep them short, and there's several examples of how that should be done. I'm sharing one of my examples because, like I said, what's nice is doing studies over a number of years before you learned how to better do dissemination. You'll see that I probably have about 25 reports that have the title North Dakota Nursing Needs Study, Faculty Survey Results, or Focus Group Survey Results, or what have you. And that is not a good example of a title. So that's pretty unlikely to be read. I picked up a pretty good example. I went looking online, especially at the Rural Health Research Centers. And what's nice about the title I put as a good example is it talks about what the key things you should get from that particular document is. And I especially like the 13-state survey because I personally, as a state organization, would certainly open that up to see if my state is included in those findings. And if it is, I would disseminate that. So some of our key products include fact sheets. This is typically a one-page document, can be front and back. Since we did the study in 2010, you know, lots of newer things have been put together. Infographics are kind of a newer version of this. I've also seen research centers use a postcard size document that they've actually mailed out to their audience. And so what it needs to do is it needs to refer to a larger working paper because, like I said, you've got to have that background research to refer to when you have questions. So as far as research findings, you need to concentrate on the bigger stuff. This is not the place for methodology. This is not the place for some of your smaller findings. You need to determine what you really want that particular audience to learn. I put an example of a fact sheet that I produced. And what I really wanted to get from this document was I wanted the users, which primarily in this case were legislators, I wanted them to understand if their county had a shortage of nurses, because that is what we get asked all the time, and I'm sure that you were asked as well. So I wanted them to be able to look at the document and determine if their particular county was in a shortage area. And so that's why the maps are there. I have lots and lots of other data, but this is kind of what we concentrated on this particular fact sheet. You need to decide who can include the fact sheet at their exhibit. So fact sheets are handy things. You can print them by the hundreds, and you can have them passed out. This fact sheet we actually we mailed to the legislators in the state, and I know that some of them used it because I actually had a legislator meet with us one time, and he had this particular fact sheet folded up in his pocket. And it was evident that he had been referring to it. You can also post it to a website, and you can also link it on social media. And again, the evaluation, how many fact sheets are printed. It's really hard to tell if people actually read them or used them when they did their policy changes, but there are other measures that you can use. The second type of product is a policy findings brief. These are typically 6 pages or less. Some of them go to 8 pages or so. They include a brief context for research, key findings, and policy recommendations. So this is really your opportunity to present, in particular, your recommendations for changes and your supporting data. Again, not including methodology, not including p-values and tables, but including really, here's the change we want, and here's the data that supports it. So a lot of times, these are used with policymakers at the national, state, and community level. They're particularly useful if you have a particular committee working on policy issues, such as a state health workforce legislative committee. So they're useful for saying, here's the current status of this part of the healthcare workforce, and this is what we think you should do about it. And here's the supporting data to support that. This also forms the basis for a presentation. So a lot of times I will make a policy brief to print out and have available, but I will then have the same graphs and same messages in a presentation to accompany it. And as far as dissemination partners, you need to find out who can help connect you with those end users. So is there a hospital association meeting? Is there a nursing association meeting? Where can you present this and pass this out in order to spread your message? And the final big product that I'm going to talk about today is your final report and working papers. And I would say most researchers start out with this. A lot of times you're required to have a final report, especially if you have a funding agency. So this would include all your details. So this would include your hypothesis, your data, your method, your analysis, your tables, everything. But what our audience has suggested, while this is important to have, sometimes it's nice to have the full report and then have a separate abstract or executive summary. So you could put, say, both of them on your website and then have the executive summary for people to review. And then if they want to read more, go into the full report, because sometimes posting, in this case, I'm going to use this example later in the presentation. This is about a 100-page report. Putting something like that out and having people download it can be pretty intimidating, and they're unlikely to try to read through it. But if you can kind of pique their interest through a short document or a short summary, that they could then go and read the full report. A lot of times people put methodology at the end of the report, or I've seen in some national studies that they have the findings report and then they have a separate technical report, because it's important to have both of that out there, especially for other researchers or others wondering how the study was done or how to replicate the study. Your dissemination partners, again, this is not something you would give your legislator typically, but research groups, conference presentations, and I would say if somebody funded it, certainly this is who you would send it to. Again, it's primarily electronic. I have seen people print these and pass them out, although it's becoming less popular with so much electronic communication now. So we've talked about 3 products, but there's a separate item which is approaches, and that's how you get the information out, and there's a lot of ways to do that as well. I talk a little bit about websites and social media, and like I indicated, the toolkit that's on that website has been updated in this area. The original one that we produced in 2010, certainly there's been a lot of change since then. But my opinion and through my experience is I have found that websites are a key place to disseminate many products, and there is an increasing push to have open access. And the reason why I say that is because when you send out your research results to your end users, I would say the majority of the time they don't need it right then. They're not ready for it. You know, they're thinking about other things. And what they need to do is be able to go get it when they need it. So really positioning yourself as a place to go get the information is, you know, maybe more important and to spend more effort on that versus sending out lots of copies of full reports. Social media can be used to further direct users to you. Again, the place for workforce research, and it's also very valuable. We've experimented with using automatic Facebook postings and advertising on Facebook at our Center for Nursing, and we found that it's a pretty powerful way to increase your exposure. So if you're not familiar with ways to do that, I encourage you to attend a training on how to do that, because it's a great way to pull people that wouldn't normally see your research results. Health trade press and media was talked a lot about, especially at the national audience level. So they really indicated to not underestimate the potential of sending out a press release on your workforce research. I know a lot of times we think, well, you know, the press is not going to really care about my little workforce study. But if the timing is right and the topic is of interest, this is a great way to increase awareness of your study. I know a lot of times I send out a press release about a study, I don't hear anything back, I don't hear anything on, or I don't see anything in, say, the newspaper, but several months later, suddenly the nursing workforce shortage or the physician shortage or what have you is of interest. And since I kind of made that initial contact, they know where to go. So they know to call me and ask me about it, and I send the study out again. Like I said, the issue groups really emphasize the importance of this. And it's also a way to find and become more visible to those dissemination partners, because there's people out there that might be interested in your research that you're not aware of. And make sure you target the message of your audience for each press release. You know, certainly putting together a press release for a small town newspaper would certainly be different than a Washington Post one. For exhibits and presentations, these are your key in-person opportunities. So your presentation and what you're presenting should be targeted to who you're making the presentation to. And you really should try, as through a lot of our products, to pull out key findings. And so if your audience is policymakers, you know, and your goal is policy change, you should directly link your policy recommendations to your findings. I've kind of learned that the hard way, because over 2002 to about 2007, I was invited to our state legislature to present findings every year. And I would dutifully, you know, present, here's the supply, and here's the demand, here's the education, and here's our projections, answer their questions, and nothing would happen. You know, no policy would happen. We would put recommendations on it, but we didn't very strongly link the policy with the data until about 5 years into the project, when I frankly got a little sick of the legislators not paying attention to our study, and so I brought my binder, which at that point had about 15 reports in it, so it was about a 4-inch, very heavy binder. I slammed it on the desk in front of the legislators, and I said, look, we've been doing research for 5 years now. We know we have this issue. You know, here's some ideas on what to do about it. So I kind of had to get their attention. I will also say it's important to pull out those key findings, because if you inundate them with information, they won't do anything either. What I've included on the slide is the front slide of a presentation I did in 2003, and you probably can't see it, but I circled the slide 1 of 92, because I had 92 slides of data, that I presented to a stakeholder group. And I did that in 20 minutes, which is entirely too much. So you really need to, you don't have to present all of your stuff, present the key stuff. It might take a while to figure out what that is for your particular stakeholder group. But I will say the most striking comment I got from the stakeholder group was, thank you so much for going through all that boring research quickly. And that's kind of stuck through me, for the last 12 years. I still remember that. So don't present 92 slides to your stakeholder group is what I'm saying with that. Exhibits, you can include something small. A lot of people, although this is improved over the last 5 years, but a lot of times, we would try to produce these full reports and have them available. Well, people don't want to take those home. They don't want to put it in their suitcase. There has been some experimentation with flash drives and DVDs, and there's been some success with that. But sometimes I almost think it's more important to have a page, a piece of paper or a card that they can take home, look up on your website and see your study later or when they're ready. So to pull everything together, I'm going to talk about 2 examples. And so the first example, that big snapshot report. This is actually a 114-page report. So I'm going to talk about what we've kind of learned. These are some of my latter products in my workforce career, and I'm going to talk a little bit about how we chose to do certain things with this. So you notice the front page does not have North Dakota Nursing Needs Study : North Dakota's Workforce. Again, I'm not the best snappy title. I think there's a real line between having a nice snazzy title and having something that's not a dignified, professional-looking title and cover page. I tend to like to use photos that I have available. I would stay away from clip art. Sometimes that makes items not look as professional as they could. So, certainly having a cover page that's colorful and useful. And you'll notice that one of the first things other than tables, I have that executive summary with the findings. This is a particularly large report, so it has a lot of findings. Probably not the most ideal. And I will say we actually printed this particular report out because it was funded by the state legislature. So they received this whole report in a COILA-bound printed document in 2010. And I'm just going to show you a section of what we did as far as findings. So across all these professions, we have lots and lots of data. So how do you pick what data to concentrate on? I want to find a particular section that would be a good one to show you. And certainly you can also download this on our website as well. So what we concentrated on, like I said, what I found most useful and what legislators and policymakers have talked to me most about are these maps. In particular, I like to use the red color and orange for counties that have the biggest shortage. So producing maps, especially when you're talking to county-level legislators, that way they can look and see how that particular profession is impacted in their county. I have gotten a lot of feedback about these retirement rate frequency. These are cumulative frequency graphs because, again, the legislators can see that and they see, oh, boy, look at this big hill. So as far as supply, that is all I present in this particular study. Do we have a lot more information? Sure, and we can certainly refer to it. But then as far as demand, I only have just a couple of key things. If you are able to do some sort of trend, people like that. Again, you'll also notice that I use a lot of pictures. And that is because, legislators and policymakers don't have a lot of time to look at this information. But I will also say that a lot of these pictures have also been used by education programs when they write grant proposals, for instance. They're easy to put on PowerPoint, and so they're easy to cross products as well. And so that's what I've done on a lot of these. And as far as providing policy recommendations, I kind of put in a box, here's the key finding, and I also make use of qualitative research a lot in our dissemination products. So I know that the issue groups didn't talk about it much, but if you're able to collect qualitative information through open-ended questions or focus groups, I actually insert those in my reports in little bubbles, and I kind of indicate where they're from. because I found that when I'm talking to policymakers in particular, that really paints a picture for them. It's one thing to show them a pie graph of the aging population or the aging workforce. It's another thing to have an actual nurse, or in this case a hospital director, talking about what the issue is. It tends to connect your data to your targeted user. That's one example I wanted to share with you. What I would also say about that particular example is when I mentioned that you should connect it at the right time with the right user. So like I said, we spent a lot of money publishing that study and printing it and giving it to legislators in 2010. In 2013, our state legislature started doing a study on healthcare workforce needs, and lo and behold, I got calls saying, do you have this data? And of course I was thinking, well, we gave you all these reports 3 years ago. But I ended up actually bringing that out again and presented it to them in 2013. And this is part of the PowerPoint slides. So again, what they really needed to know from that was who to call, because they certainly still didn't have their copy from 2010, and they needed it now. It was relevant now because they were looking at it. The second example I'd like to share with you is a brief I did on the nursing needs study. Like I said, we did a study for 10 years, and so this is kind of the study at the end. It's looking at all 10 years. And so what we produced for this, when I talked about different products, we reproduced 2 primary products. One is a longer final report for a document. It's about 40 pages, although I will say that this document is actually a compilation of several other documents. So we have a healthcare facility survey report that we have some results in here, et cetera. So there's a lot of other pieces that are referred into this piece. But I primarily disseminated this one. And then I also produced a policy brief, which is a shorter document. So I'm going to take a look at the bigger document for now. I'm hoping I'm not making everyone busy here. So again, we start out with an executive summary. Now, the purpose of this particular document was not necessarily to change policy, but what it was designed to do is to say, here's what we found, and here's what the Center for Nursing is doing. So if we're trying to change policy, the blue that you see on here in italics would be direct policy recommendations. You know, you would say, we believe so-and-so should do this, and that's where I would put them. But I split it into sections across the different part of the workforce, and I put basically our policy issues in blue italics to really bring them out. Of course, we included lots of pictures, so I encourage you to make them as colorful as possible. You know, another thing you can do is if you are working with a bunch of partners to list them somewhere in your document. For one thing, these are all your dissemination partners. And so these are the people that you can also use to push out your research. And I'm just going to get down to one section here. Again, maps. That has been the most useful item, really, is map. Because, again, a lot of what I work with are those policymakers. And here's another one of those quotes from another study. So I keep all of my open-ended questions, and I use them to find out what direction to go, but I also use them to paint a picture for policymakers. I would also suggest when you disseminate your findings, you vary what kind of graphs. I spent many years using a lot of bar graphs and have started to branch out into other type of circle and pie graphs. And so we took all of this. So this is the place where there's a lot of the findings from across the 10 years of the study. And then we pieced it down to just 4 pages. And so that's what this other document I'm going to show you is. And this document we actually printed, and it is actually a 4-page document, but it's designed to print on like a legal-sized paper. So this is the cover, and then this is the inside, and then there's a back cover. And it was designed partly to really bring, first off, I wanted and again, we printed this for legislators in the state. We wanted them to know that there's a lot of different facets to the nursing population, and we wanted them to know what the Center for Nursing was. That was our main goal here. Again, if you had some overlying policy recommendation, this is where you'd put it, right on the front. And out of all those findings, what did we concentrate on? We concentrated on where students were coming from, made a map. We concentrated on the fact that we have very low minority rates because there's some work to do diversity stuff in our state, so we wanted to emphasize that. So certainly looking at what's going on in your state as to what you would emphasize. Of course, there's our maps, our supply and our demand maps, because again, that's what people really want to see. And on the very back page, what did I put? I put our projections. Why did I do that? Because our policymakers are always asking us, do we have a shortage? Are we going to have a shortage? And where's the shortage going to be? Can't really answer that, but I can answer the statewide question. And here we are with our question. So that's kind of how we decided what to put in this, and then they can certainly contact us. And in fact, we were contacted, and we had a larger presentation, again, based off that main policy brief. So that concludes my presentation with my examples. I've included links to those documents I just talked about, and I believe I'm ready for questions.
Thank you, Patricia. That was wonderful. Okay, at this point in time, we'll begin the Q&A session. Once more, you may ask questions using the chat panel on the right of your screen. Please make sure you direct your questions to all panelists. Patricia, first question. You talked a lot about disseminating research in a lot of different places, but didn't mention peer-reviewed journal publications. How does the approaches you described work within journal articles? That is, how can you publish a journal article after publishing results in policy briefs and finding reports?
Well, you know, that is the $100 question right there. And that is the question that I should say, struggled with our Rural Health Research to Diverse Audiences project, because a lot of those centers, and I'm betting a lot of the researchers online as well, are in academic settings. I was in an academic setting myself, too, where it really emphasizes peer-reviewed publications. How I've dealt with that personally is I've really emphasized the use of fact sheets and policy briefs, which have those broader findings, and I've reserved the statistical analysis and the detailed tables for my journal publications. And of course, you know, you should always be upfront. So when I submitted those journal publications, I said, by the way, you know, some of this higher level stuff was put in this policy brief. Here's a copy of it. But it hasn't really been an issue. It would probably be an issue if you produced a lot of those full working reports, especially on a website, because a lot of the journals now have pretty detailed website policies at this point. So I would investigate that if that is the case. But I will say that with everything moving to open access over the next few years, I think that's going to be less of an issue.
Thank you. Patricia, could you elaborate on your experiences using social media such as Facebook and Twitter for disseminating health workforce research? Are these types of meetings very effective? And also, can you give some cost estimates for advertising your research on Facebook and other outlets such as these?
Well, sure. And, you know, I didn't produce the new dissemination toolkit because I no longer work there, but there is some information in that toolkit. But at the Center for Nursing, we've experimented twice over the last year with using Facebook, and with that you can actually, you can put together an ad, and the ad has a very limited amount of words, so you have to say something like, find out more about your physician workforce, go here. And what you can actually do is you can target Facebook users. So for instance, if you wanted that particular ad to appear on the stream of everyone between age 19 and 45 who mentioned the word physician in their information, you could do that, and you could set a price limit. So Facebook has changed the way they do it over the last year. But you could say, you know, I want to spend $100, and then it will come back and say, okay, for $100, we'll put this ad on 45,000 user streams. And so you could also target, by the way, states. So you could say all those in North Dakota or Ohio. And so we've done that, and what's nice about that is Facebook has a lot of evaluation outcome measures. So they tell you how many people that actually appeared on the stream, how many times people clicked on it, how many people shared it. So it's a great way to track that as well. I think it's a real up-and-coming strategy for disseminating this kind of information.
Thank you. Next question. We produce reports and have a listserv, but we still have a hard time getting the word out about our work. How do you disseminate in a way that will catch policymakers' attention?
Yeah, good question. You know, we actually have also, you know, like I said, we have a pretty extensive listserv, and I use Constant Contact for our newsletter. The nice thing, and the not so nice thing about Constant Contact is, you know that if you send that report out by email, on Constant Contact, our newsletter is seen by, say, it's opened by, say, 20% of the 18,000. So you'll know right away if people aren't actually opening it. You won't know that if you just send it an email. It's really hard to get people's attention in email because there's so much of it out there. And so limiting how many times you send emails and really targeting who should get it. You know, I wouldn't try to send, although I do, I wouldn't always try to send it to a mass audience. You know, certainly identifying those you really want it to go to would help as well.
Okay, next question. For the most effective communication, what staff or set of skills would you suggest embedding within a team? Any advice on what FTE skills would be needed to build and maintain an effective dissemination strategy?
Well, that's an excellent question. At Center for Nursing, when I actually moved from the university setting to the nonprofit, in 2011, I was by myself. So I didn't have any staff. But since then, I have a full-time communications and marketing director. And that person, and I think you need to have some person, or if you're at a university, access to this, someone with graphic design abilities. You know, the large report I showed you, I actually graphically designed that myself because you get pretty good at wrapping pictures, because it's really important to be able to design it in such a way that is graphically pleasing. But to have someone with that skill set, it would be really good to have someone with a skill set of website, newsletter, mass communications, and someone that knows a lot about that Facebook. So right now I have a 1.0 FTE for that in our center.
Okay, thank you. What are some of the main design considerations to keep in mind when designing fact sheets? Word count, white space, use of color, font size, density? Any resources that give me more guidance on this?
Yeah, all of the above. And I will say that the toolkit itself provides a whole bulleted list of some of that to keep in mind, including font size. But certainly, you know, when you design these, you have to kind of keep in mind how you're going to print them. Some of the fact sheets I used in this presentation were from the Center for Rural Health, and we presented them in kind of a green, gray, black format. So I was limited with those colors. Yeah, certainly some white space. I would always put a picture. I would always put a policy recommendation on the front if that's what you're trying to do, and make sure you have your contact information on it as well.
Okay, here's another one for you. I'm intrigued by infographics. Do people actually use them? How do you learn to create them?
That's a great question. You know, that is such a new product that I have actually not personally produced one. I know that several centers for nursing have used them. I know then HRSA has produced a number of, in fact, I think you could probably search for infographic online and find one. I'm intrigued by them because it fits a lot of what we talked about as far as dissemination strategies. They're primarily produced of graphics and pictures of big findings to produce a story. And so I don't know a resource for that, but I'm pretty sure you could find one online.
Okay, next question. Well, this all sounds great, but how do I get started?
Well, yeah, that's the hard part as well. You know, I would get started just simply with, you know, first off, making your final report, because you always, if you have all the information together in one place, you usually have to have that anyway for your funders or whomever. And then I would sit down and think about what you want to happen from it. Assuming that you're not doing research just for the basis of doing research, which hardly is ever funded these days, you know, sit down and look at all your findings and think, okay, well, this finding I think would be of interest to this group. And then think about ways to get it to that group. So I would even just start with 1 or 2 primary findings. Maybe produce a fact sheet and get it to a group and see how that goes. So certainly pilot testing some products and some ideas, because yes, you could spend a lot of time doing this. It takes a while to work up to including a full plan, but I will tell you, once you have one fact sheet, it's not so hard to do the second one, because you basically copy and paste new information. So it's getting to that first step, which sometimes can be the hardest.
Okay, thank you. Next question. I have heard that people respond well to maps. Do we have to hire someone special to make maps? And if so, what kind of person? What are some standard software packages or web tools that we could use?
That's a good question, too. Typically the maps that I have used more recently are produced using a GIS, or Geographic Information Software. Usually geographers use that, so if you have a school nearby that has a geography department, they can usually do that. That is a pretty intensive training and a pretty intensive piece of software to use. Early on, my first couple years before we had that, I'm not ashamed to admit that I used basically a map of our state, and I used Word Paint, which is the painting part of Microsoft Word, and I basically colored in boxes using the fill-in capability. So you could certainly do that too. It's not the best way to do it. It's certainly fraught with error. The GIS packages actually link your data to the map. So yes, you would need a GIS person to do that, mostly.
Okay, and this is kind of a follow-up question. Is there a single graphic software package you would recommend for using for creating presentation graphs, charts, maps, etc.?
Well, as far as the maps, again, you would use the GIS software that's out there. I actually purchased SPSS maps one year, and to be quite honest, I didn't find it that useful. I use SPSS for a lot of other things, though. I primarily use Excel to produce my graphs. In fact, I take things from other like SPSS or SAS or whatever, and I put it in Excel because I like how the graphs turn out. So those are the primary products that I use.
Do you have any tips for developing dissemination and evaluation plans within grant proposals, and how you evaluate dissemination impact?
Yes, certainly, and with all grant proposals, you certainly have a work plan, and our dissemination plan talked about that. So certainly putting in a timeline of steps, you develop your final report, develop and actually indicate what kind of products you might develop from that report and who you're going to submit it to. So any work plan, of course, would include activities and who's going to do it and timeline, and then the outcomes. And, the outcomes can be kind of difficult with dissemination. I know early on in the Rural Health Research to Diverse Audiences project, one of our outcomes we planned on measuring was if people actually picked up the findings from the research centers and used them. To be quite honest, we never really were able to do that. We tried over a number of years to try to figure out how to do that because it's very, very difficult. So we primarily stuck with how many did you print, how many did you pass out. It's always good actually to keep kind of a journal if you have people call you or tell you that they've used your stuff, so you can kind of keep track of that. You always think you're going to remember that, but you don't. So to keep kind of a document open, when you get calls or you see that legislator with your fact sheet crumpled up in their pocket, to write that down. It's not, it's not the best quantitative way to document that, but there isn't a lot of other strategies. Facebook is nice. They have lots of hits, or they have lots of likes and shares. Websites produce lots of data as far as who's downloaded your information, and if you're using a software such as Constant Contact, you can tell who opened and actually who even downloaded your research document.
Thank you. Okay, another question. Could you give a specific example of disseminating the same information to two different audiences? That is, how did you change the delivery of the information for these separate groups?
That's an excellent question. So, for instance, I have done a number of education studies. I've talked to faculty, I've talked to nursing education programs. I also did a study on the use of simulation. And so, for instance, I have presented that information to nursing education programs, especially deans and chairs. And in that case, I really concentrated more on kind of the global findings. Here's how many faculty you have, here's how many that indicated they've been trying to be recruited, for instance. Some of the more global information that they would want to know. I've also presented some of that same information to policymakers. In that case, I concentrated more on, here's how the programs are feeling. A lot of them are feeling, overworked. Your faculty are working X number of hours a week. They're having trouble with clinical sites. So certainly tailoring to who you want and what you want to get out of that presentation is important.
Okay, Patricia, I got one more question for you and then we'll wrap it up. If you could describe the 3 most important considerations when you go into disseminating your work, what are they? What are the 3 most important considerations when you are disseminating your information?
Well, I think the most important is what do you want to happen? To think about what do you really want to happen when you send this out? Do you want someone to change policy? Do you want someone to expand a program? Do you want somebody to give you more funding to do more research? I think what do you want to happen is the number one. The number 2 is, so you've decided what you want to happen, who do you need to give that research to make that happen? And also, they may not even pay attention to it right now. They may not be ready for it, but how do you make sure that they know to come to you when they are ready for it? And number 3, to make it in a user-friendly method. I know as a researcher, as I was, coming up and through my doctoral program, I learned a lot about p-values and significant values in tables. And I will say that as we started working on this, I have no p-values in tables in most of my documents because legislators don't care. Typically, what they care about is what's significant to them. So make it in a way that that fulfills your first 2 items, which is what do you want them to get out of it, what do you want them to do, I think is the most important.
All right, thank you, Patricia. That was wonderful. I very much enjoyed it. I think a lot of us disseminate our work, or at least attempt to, but I don't think most of us have actually thought about it in the detail you have. So thank you very much for this presentation. And thank you out there for attending our webinar. Just to let you know, we will be posting our slides shortly to our website. So if you want to download them, check back very quickly at healthworkforceta.org. We hope to see you again in the future. Thank you, and have a good day.